Hello everyone and welcome to this audio podcast. This audio podcast as part of the Nephrin molecular series or edition. This audio podcast as part of a tornado PlexAR. This audio podcast as part of a monster Bostix. In this audio podcast, a little bit around looking at sort of chronic illness looking at chronic illness and sort of linked with the specialty in around pediatrics or pediatric nephrology. So observes that observes sort of stress and coping are arguably the most broadly researched area in around psychology disciplines. At the same time, works around coping, where in around coping, and coping is about the way people manage often sort of stressful conditions. Coping can be described as a strategy, and published works from going back as far as sort of the 1980s, not around the 1980s or mid 1980s, inform a function of continual appraisal and reappraisals. So coping is a precursor of psychological growth to an extent, but also a sort of a link to lessen aspects around anxiety, at least in evidence works. And one author in around 2008 discusses coping specifically in regard to young people, stating that coping represents thoughts and feelings and actions that an individual uses to deal with problematic situations encountered in everyday life and in particular circumstances. In works by a team in 2003, the authors had informed that people utilize sort of what had been referred to as a caravan of resources that people gather through life and that can be taken with them. Support resources that may come from come from learning and connectedness to for example, family, friends, and school as networks. If the environmental load is substantially exceeds the person's resources, then a stressful situation exists. Information is one such resource used as support as part of the coping process, and acknowledges the complexity of coping situation in young people. And works by one author in around 2013 identified a sort of a clear association between information and the ability for young people to cope with long-standing conditions following an information coping trajectory, becoming information donors, where they're sharing knowledge and supporting others through work, and information supporting others through work, as and through other sort of modalities. The duration of transition, for example, from teenage years to adulthood, is known to be a particular challenging time for young people generally. and works by author in 2004, by a team in 2004, had identified that the critically the cruciality, of communicating information effectively and appropriately to help people cope with illness, with sensitivity needed in health communications. Information and communication in healthcare context forms a complex network of support, in which there can be tensions due to the lack of information and support, or misinformation, misunderstanding, or mistrust. Works by several authors also inform of examples of contradictions or dilemmas, where for advice and support may be viewed by a receiver as either helpful, where this would be where helpful would be referred to as a positive experience, or sort of where there's a terminology that has been utilized by authors in works in around 97 in around 97, had informed, for example, butting in as a terminology can follow up sort of a negative experience. So young people experience a range of emotions when living with ill health, including hindrances, barriers to effective communication around fear and uncertainty. Works by an author in 1998 have found that communicating information about illness as a form of support can reduce uncertainty and help people cope. Works by authors in 1999 on communication identifies the importance of understanding the management of uncertainty in a health context, where in some instances people want to reduce uncertainty because it is threatening, and at other times uncertainty allows people to have uncertainty also allows people to have to gain hope, and can remain optimistic. In works by an author in 2003, there's in works by an author in 2003, by a team in 2003, there is works to inform that young people's shows that young people, and sort of the maturity and their preference for communication are and can be complex, showing contradictions, tensions, and in some cases binary options. So, for example, a physician as a hero, or a physician as a villain. And works going back from early 1970s to sort of up to the mid 1980s, inform contradictions also occur when individuals have different constructions of the situation, or phenomenon, understanding or perceiving things differently, and this can lead to misunderstandings. Works by an author and team in the early 1980s informed these contradictions are evident in amongst coping literature. Works in the mid 1980s informed that emotion and coping within young people identified as three major themes. Number one, where there's a stressful encounter, where a stressful encounter is dynamic and unfolding. Number two, people experience contradictory sort of states of minds and emotions. And number three, people cope in complex ways. There's works in sort of in around 2010 by a team that inform of a theoretical framework to explain information exchange in around the healthcare context, specifically for young people. The model identifies both positive and negative influences on information and knowledge exchange in clinical contexts during transition years, thus age between 13 years of age to 19 years of age. Often, where the information support and exchanges in the clinical context are negative or lacking in some way, young people seek other support from a broader support mechanism or mechanisms in amongst the network. Increasingly, this extends beyond friends and family, and extends can extend to for example, in on social media, on the internet and through social media. For example, in works or sort of in around 2005, authors had informed that there's the need for not just trustworthy but accessible information for young people, but where there's also identified, where the authors had identified that for young people, for young people, there's there the approach the approach is has to fit within a sort of the approach to support or accessible information, for example, has to be aligned to, for example, the lifestyle, or the sort of life trajectory, or the trajectory around and therefore it is not surprising to find that young people can exploit a range of information, accessed in different ways, including including utilizing tech to fulfill information requirements. So more sort of research in around sort of coping research in young people with LTCs or long-standing conditions is or has been required, with the views of health professionals, the main people involved in young people's care. And this information is and has largely been absent. The information is uh, uh, again in documented works from 2014 has informed by authors that the works around healthcare professionals, sort of the main people involved in the care of young people suffering with long-standing conditions, is largely absent. And so this information this so thus it would be a sort of more advantageous to carry out sort of to carry out sort of action based sort of research or works, with the aim of understanding how the medical professionals implement care for young people with CKD or chronic kidney disease, for example. And in addition to understanding in addition to understanding the strategies that young people sort of adapt, and how for example, the internet and social media can support them, and this would be consistent with works that have been published by authors between early 1990 up to between authors between works from 1990 and up to sort of 2012, and where at the same time, where coping and gathering resources is concerned, the Renal Patient Support Group, the RPSG, has been one example of a social media platform which has proved a resourceful to young people, and to young people sort of accordingly. That draws this audio podcast to a close. A subsequent audio podcast will delve into sort of sort of in around the Renal Patient Support Group, the RPSG, but also in around the Kidney Disease and Renal Support Group, or KDAS group for kids, sort of in a subsequent audio podcast. That draws this audio podcast to a close. Our audio podcast is part of the Nephrin Molecular series or edition. This audio podcast as part of a Tornado PlexAR. This audio podcast as part of a Monster Bostics.